Hello and welcome to this Fish Farmer podcast special, brought to you in association with Ridgeway Biologicals. I'm here with Gus Ramirez, Aquaculture Business Manager with Ridgeway, and we'll be talking about vaccines in aquaculture. So Gus is a well-known vet in the Scottish aquaculture industry after being around for more than 15 years. He's an expert in salmon health and vaccines. But Gus, for those who don't know you so well, how did your career take you into the world of fish health and specifically into Ridgeway?
Oh, hello, Rob. First of all, good afternoon to you. Thank you for having me here. As you mentioned, I've been around for the last 15 years, and the way I got into this was I'm a vet by training, so my first degree is as a vet, and I always wanted to pursue an academic career in fish diseases. So that's why I came to Scotland, or I went to Scotland to complete a PhD in fish or aquatic vet studies, and that's how I started to get into the fish health area more deeply, moving from the general or broad vet studies more into the fish health, and then I went deeper into what is vaccine development for farm fish, and I've been doing that ever since, and that's basically how I've got into it. So a vet by training with a PhD on fish diseases and specialization in vaccine development for farm fish.
And where did you study for your PhD?
And at the Institute of Aquaculture in Stirling. That's where, yeah. So just for extra information, my vet degree is from Mexico. I'm originally from Mexico City. So I obtained my vet degree in Mexico City at the National University of Mexico, and then I came to do my PhD in Scotland some time ago. Yeah.
And what's the appeal particularly of looking into the vaccine side of things for fish?
Well, as a vet, you learn about the different tools that you have to improve health in the animals. And to me, it was always fascinating to understand how the immune system help the animals to counteract infections. So it really came from understanding the host and the pathogens interactions, understanding how our bodies, or the animals, or in this case the fish bodies, are able to cope with invasor, and how they can counteract these infections, and taking that to our benefit, to mimic that and train the immune systems to be prepared when the infections come. So that's the part that really took me into the vaccines. As you know, there are other aquatic organisms which are farmed as well, and don't have a fully developed immune system, which means we cannot make use of that. And that's why I'm working mainly with fish, because they have that capacity to set up a memory in their immune response.
And can you tell us something about Ridgeway Biologicals?
Oh, yes, of course. Well, just to connect with Ridgeway, after I finished my PhD, I did a postdoc. I was a postdoctoral researcher at the Institute of Aquaculture as well, with a work that we did at CIFAS, developing vaccines for balangrass. And from there, I jumped into the industry fully. Like basically, there was an invitation to join Ridgeway to work with them, developing more vaccines for other species. And that's how I got into Ridgeway, really, moving from an academic career as a researcher at the Institute of Aquaculture, helping now in this side, which is the industry, which is really like a little bit different, working more closely with the farmers and understanding from a different perspective how the farmers are coping with the problems in the real life. So that's how I got into Ridgeway. Back then it was an independent company, Ridgeway Biologicals Limited, and it's been a lot of changes since then.
So Ridgeway now is part of a bigger international group, isn't it?
Yeah, that's correct. It was about 2019, I think, end of 2019 or beginning of 2020, when we were acquired by Ciba or Ceva Santé, which is a French corporate, one of the biggest. I think is at the moment fourth or fifth largest company in the animal sector worldwide. And we've been part of Ciba for a good period of time now.
So to those who aren't so familiar with vaccines and how they work, I guess there's two real main kinds of vaccine. Could you say a little bit about those and what's specific about autogenous vaccines?
Yes, of course. Well, autogenous vaccines are vaccines which are, let's say, purposely made. So they are tailor-made and customized to the needs of the farmers. So, I mean, this is a classification which we can consider from the, let's say, the scope of the vaccine development, and as well from the legal point of view, a little bit, if you want to say, because are vaccines which are intended to be used only by the farm or the site or in the area where the affected sites are. So the intention of these autogenous vaccines or auto vaccines is not really to have a global scope, but more like a dedicated area or target. So I would say this is one of the main differences. Of course, there are certain rules that need to be followed to be able to produce and use a vaccine. But let's say in simple terms, one of the main differences is the scope on which the vaccine will be used. You know, it's more like targeted to a specific clients rather than aiming for a global approach. And this is interesting when you think about it, because if you think about, for example, the COVID vaccines, or in the human pharma, or in most of the vet vaccine development industries, generally the pharma industry always tries to go for a global approach, something that can be sold worldwide, and obviously there are reasons behind that. Some of them is, of course, tackle the pathogen in a global form, but autogenous is the opposite. Is trying to make something purposely for the affected sites.
And your starting point is effectively a live pathogen, which you can then make safe and turn into the basis for a vaccine.
Yes, that's correct. So the base of this, or the main one of the main things to be able to develop the vaccines, is to have a full understanding of the situation at the farm. So this is a big difference. So for us at Ridgeway and the vets that we work with, and the people in Ridgeway, at Seva Ridgeway, that works developing this, is about really partnering with the customers, understanding what's happening at their sites, why is the disease fish suffering these processes, when, for how long, and then it's not just the clinical history behind the cases, but also understanding the genetics of the pathogens affecting that fish or that population. It is very important to know what are these variations that the pathogens are showing, so that then we can make an informed decision on which elements should go into the vaccine to protect against those, specifically in the farms.
So fish in the sea, farmed fish, face a huge range of different pathogens and biological threats. What are the key ones that you're dealing with in terms of salmon on the coast of Scotland?
Yeah, well, one of the other very important, let's say, aspects or characteristics of autogenous vaccines is that they have to be made with kill antigens. So that means there cannot be any replicating antigen, bacteria, or virus as a part of the vaccine. So for that reason is that most of the vaccines are produced with whole cell bacteria, and that's why, again, most of the autogenous vaccines are dedicated to control bacterial infections. It is possible, it is legal, and it is feasible to do autogenous vaccines for viruses, for viral diseases, but it's not really the main approach. And some of the most important bacterial pathogens that we see at the moment are emerging, or new pathogens that have not seen before, which include new species of gram-positive bacteria and other variants. That's the other thing that we see coming. So we have, for example, in the last 5 years, we have the emergence of new strains of well-known pathogens like Aeromonas salmonicida, and we have the emergence of new variants of Moritella, and also, as I was saying, new species of bacteria, which is closely related to what currently is known as Pasteurella salmonicida. So those are some of the main ones Of course, in Chile, the industry is affected by another pathogen, which is Rickettsia salmonis, another bacterial pathogen, and is starting to affect the industry in Europe as well. And that is another one which is showing up recently. So I would say from the bacteriological side, those are the most important at the moment, affecting or emerging around Europe in salmon.
And these bacteria are evolving all the time. So a vaccine that was maybe developed 10 years ago might not be so effective now.
Yes, that's correct. And that's another important issue when you talk about this classification of commercial versus autogenous or licensed and registered vaccine versus autogenous. Normally, when you think about it, the time that it takes to launch a commercial vaccine is between 5 to 10 years. And what we have seen is that the pathogens evolve at a very fast pace. So autogenous vaccines can be produced in as short as 3 months, 4 months. And then, of course, that allows you to be on top of those changes in the bacteria or the pathogens. And this is a real advantage, to be honest, when you see that happening in the field. It's like you are able to protect fish against pathogens which have not even been named yet, don't have an official name yet, and you've already been protecting millions of fish against those for years or a couple of years. So that is a big advantage, and that's a big difference. And that just takes us as well to another topic, which is the legislation, which is how are at the moment the processes to approve and register and get the license for a commercial vaccine. So, but maybe that's a topic for another moment. But yeah, coming back to your question, it is a big advantage to be able to produce the autogenous vaccine so quickly when you compare to the time it takes to produce and register and license a commercial vaccine.
Are we seeing new strains developing faster now, or are we just maybe better at detecting them?
I think it's a combination of both. I think as the industry keeps improving, and I'm talking about the fish health industry, and the techniques are more targeted and orientated, we are of course discovering more things around. But also there is a pressure in the environment which is promoting these changes. So I would say, in my opinion, it's a combination of both. And it's a reflect of what happens also in other industries like the poultry or the swine. As any of these industries, these are under pressure, and these pressures make these changes or push for these changes to happen.
So when you're working on an autogenous vaccine, it's really a question of working in partnership with the farmers then, because you need to be very aware of what's happening in that specific environment.
Yes, that's correct. And this is precisely what I love working in autogenous vaccines. As you remember, I mentioned in the beginning, I joined the industry when I was a very strong believer of the academy, mainly because I believed in this concept of autogenous vaccines, which is working with the farmers and really understanding what's going on there to be able to produce something for that. It's very different to going around selling a product which has already been developed elsewhere and just coming with the marketing for it. This is really about what's happening, understanding the pathogen and working with them. And of course, the farmers understand that. And then they are very into it, and they support the project. They allow the samplings to be completed and all of that. So yeah, it's definitely a partnership with the farms.
What kind of things do the farmers have to do in order to take part in the partnership? In other words, what sort of things do the farmers have to do to make this work?
Well, one of the first things that I encountered when starting doing this was understanding the idea. Because in the past, auto vaccines or autologous, as sometimes they are called, autogenous, had a kind of not the best reputation. It was like a misunderstanding that these vaccines are like made probably in the back of a lab with no proper regulatory inspections and so on. But the truth is that it's not the case. Autogenous vaccines in the UK at least are authorized by the BMD, and these are very heavily regulated. So actually, for every batch that we produce has to be released by the government, by the authorities. So there is a strict control on how they are made. And when you look into the scientific literature or generally the vaccines literature, you will see that probably around 70% of the bacterial vaccines, licensed or commercial vaccines, are made of wholesale bacteria. They are wholesale bacteria. So the approach is not so different. It's basically the same that is used in autogenous vaccines, basically wholesale bacterias. And as I'm saying, they are heavily regulated. So once you get the farmers to understand that this is not so distant from what has been traditionally being used, then you give a first step, because they understand that it's not a low quality product. It's actually basically very close to other products, and it's actually made in collaboration with them. So then once you get that, then they need to be open to talk to you about the situation at the farms and collaborating in samplings, for example, opening the doors to allow our scientists to come and collect samples and do this consecutively, because as I was saying, it's not just about coming and selling one product and then leaving. It's about working with them throughout the year and throughout the years, doing constant sampling, understanding those results from the samplings. And as you do that over the time, you are able to compare what's now, what was there before, and you can see a history of the situation, which is really important. I would say those are key elements, yeah.
I was going to say, historically, one of the issues for the fish farming industry has been its use of antibiotics. Do vaccines represent a way to reduce that and reduce the threat of antimicrobial resistance?
Yes, of course. In my opinion, is one of the most important or the most important tool that we have in the industry to reduce the use of antibiotics. You can see, there is a clear evidence of how this has worked in the aqua industry. So the moment the vaccines jump into action, the use of antibiotics went under control, and that is clearly the situation. The problem is that vaccines need to evolve as the pathogens do as well. So changing your vaccine to what you need when you need it is key to be able to keep seeing that as we saw in the past. And it's a product that really benefits a lot and helps to keep the use of antibiotics under control. And of course, that reduces the risk of developing antimicrobial resistance.
It's clearly a fascinating field for a vet to get into. Do you have any advice for somebody who's maybe looking at the aquatic side of things, who's interested in becoming a specialist in vaccines?
Yes. I would say study, learn a lot about the immune system. There's a lot to be done. There's a lot of research needed on the immune system. To be honest, it's still in early stages, despite the fact that we're talking about already quite a few decades. The status of or I would say the know-how on the salmon or the other fish species immune system. So there is a lot to study on that and research to be developed. And also when you are already in the field, listen to your customers. Be prepared to offer these vaccines as a solution, and trying to work with them. So my advice is basically that for the vets who want to go into the field. There's a lot to be done in the fish health and in the fish immunity fields for studying and researching, and I would advise them to do that, and then once more specialized, then of course jump into the field and work with the farmers.
And of course, congratulations are in order, because Ridgeway has been shortlisted for this year's Aquaculture Awards in the collaboration category. Could you tell us a bit more about that and the project that Ridgeway was nominated for?
Yes, thank you very much. Yeah, this is great. We're very happy at Ridgeway about this nomination. We are very excited. This is basically what I've been describing. This is a recognition of the work that Maui and NOS, Maui Scotland and NOS have been doing over the last few years, really. I mean, it's been great having the support of Hervé specifically and all the team in Maui. I don't want to keep saying names because it's really all the team who have understood these aspects that I was mentioning earlier. And we've been working on this, and we've been, I would say, on top of the emerging bacteria in Scotland. And as is clear, the results are there. They are happy with what's going on, and we are excited that we can serve to the purpose of keeping the use of antibiotics at bay, and we can keep the production ongoing. And I think if we are able to replicate, or if the pharma industry is able to replicate this case at a bigger scale, then we will be able to start transforming the situation and have a bigger or wider impact, which is ultimately my purpose of doing this. No?
And will you be there in Glasgow for the awards?
Yes, we will be there. We will be there as a SIVA Ridgeway company. So we'll be attending the event. We'll have a stand. So you're very welcome to join and have a talk to us if you want to know more about what we do. And we will be at the awards, of course. Looking forward to that.
Gus, thanks so much for joining us. It's been fascinating to learn more about fish vaccines, and look forward to seeing you in future.
Well, thank you, Rob. Thank you very much for the invitation. And yes, we will be very happy to talk later. As I was saying, there is so many topics that can be discussed in the future, and I will be more than happy to keep this conversation later. But for now, just to thank you, and yeah, looking forward to the awards and the Aquaculture UK event and all the things that are happening at the moment.
Thanks for listening to this podcast special. This has been a YVEX media production for Fish Farmer in association with SIVA Ridgeway Biologicals. Listen out for more podcasts soon, and in the meantime, catch more news and insights from the world of aquaculture at www.fishfarmermagazine.com.